So the cool thing about cupping, if there is an injury condition where skin traction seems to help it resolve or recover faster, cupping really seems to help with that. And so that would be superficial sensory nerve impingement syndromes that are actually relatively common. I had this cool experience a while back of a patient who came in with a superior cluneal nerve entrapment syndrome. And the way that you tell if you have that is you grab the skin over the mid to low back and you twist it around a little bit. And if that recreates the pain that the person's experiencing in their SI joint, a clear sign that that nerve impingement is the thing that's involved. It's more common in folks who have metabolic conditions. Some people just seem to have thicker skin and things tend to get stuck. I have particularly thick skin. If I try to like grab and distort my skin, I have to grab quite a bit of it at a time and it can be kind of uncomfortable. So I think personally that I am a great candidate for cupping therapy, also because I get a lot of really random nerve entrapment syndromes that are zero fun for me. You'll notice that I'm moving these cups through a range of motion and that I'm placing the cups somewhat haphazardly. If I was doing this from a more traditional Chinese medicine perspective, I probably wouldn't do them exactly this way. I might have a bit more specificity in mind, but I'm kind of doing this more from I am trying to create traction through my skin and let them move around. And I've written a blog about why I think cupping can be useful in the context of these superficial skin-related conditions. And I would invite you to go read it because I will have it linked in my bio. Useful for these sort of skin impingement conditions, seems to be useful for people who have relatively thick skin. I am one of them. I think most of the evidence around these being useful and helpful for injury recovery are probably overblown. There is definitely some local tissue damage that happens with cupping. You can see by the redness and the bruising that happens, especially when I will go through stretching motions while with the cups on. But what I imagine most of that stretching and bruising helping with is relatively superficial. So it's going to be the small arteries that you're breaking inside of the skin itself.